Diabetes contributes to dry eye in four main ways: by affecting the sources of all three layers of our tears and by affecting the cornea directly. Before we get into it, be sure to like this video if you learned something, subscribe so you don't miss out on any future eye health and news. Goblet cells are located in the conjunctiva. It's this clear tissue that covers this white shell of our eye that's called the sclera. These goblet cells secrete mucin, which is a mucousy layer that helps to hold our tears against the ocular surface. This mucin forms the innermost layer of our tears, and in diabetes, the chronic hyperglycemia leads to oxidative stress and inflammation that causes damage to these goblet cells and also reduces their density. Without proper goblet cell function, the tear film becomes unstable, the tears don't stick as well to the surface of the eye, and this all leads to more rapid tear evaporation. This type of dry eye is called evaporative dry eye. The lacrimal gland is located underneath the outer part of our eyebrow. This is what produces and secretes the aqueous or watery layer of our tears. This is the most robust and middle layer of our tears that moisturizes the eye and provides it with oxygen and other nutrients that are contained within that layer. Diabetes causes inflammation throughout the body, and this inflammation can directly affect the lacrimal gland, causing reduced production of this watery layer of our tears. I think many people are familiar with the term diabetic neuropathy, which can cause numbness, tingling, and pain, usually more so in the legs and feet. But this effect on the nerves can also affect the lacrimal gland. This nerve signal to the lacrimal gland can be disrupted, reducing the production of this middle layer of our tears. Diabetes also causes microvascular damage. This is what affects wound healing. Many people are also familiar that the distal limbs tend to have more difficulty healing, which can sometimes lead to toe, foot, or leg amputation in severe cases because blood flow is not getting to that area because of this vascular damage. Well, this vascular damage can also occur in the eye. Many people who have diabetes see their eye doctors regularly to monitor for something called diabetic retinopathy. This is a very serious condition as well and does need to be monitored with dilated eye exams. But today, focusing on dry eye, it can also lead to dry eye because it's lacking the blood flow that the lacrimal gland needs to function at its optimal level. So the lacrimal gland gets hit from all angles: inflammation, nerve damage, microvascular damage. All of this leads to the reduction of production and secretion of that aqueous, watery middle layer of our tears, leading to more dryness and what's called aqueous deficient dry eye. The Meibomian glands are long, skinny, vertical glands that line the upper and lower eyelids. They produce and secrete an oily substance that we call meibum. This creates the outermost layer of our tears to slow down evaporation. Diabetes causes damage to these glands, which we call Meibomian gland dysfunction. The oxidative stress that occurs in diabetes damages the epithelial cells within the Meibomian glands, which causes poor secretion and leads to their obstruction. Diabetes also alters the composition of the meibum, causing it to thicken and become stagnant, leading to further blockage. The chronic inflammation that occurs in diabetes can actually lead to keratinization of the gland openings. You might be familiar that keratin is in our hair, skin, and nails. You can kind of think of it like a sort of thin film of skin growing over that gland opening. So that causes further blockage and backup of oil in the gland that can actually lead to gland atrophy, which is essentially gland death. And once this occurs, it cannot be reversed. Also, just like the lacrimal gland, Meibomian glands also suffer from reduced blood flow due to microvascular damage, leading to gland atrophy. So the reduced function and sometimes permanent loss of these glands leads to faster tear evaporation and therefore evaporative dry eye. All of these factors lead to tear film instability, leading to tear hyperosmolarity, which causes further inflammation, further ocular surface damage, leading to worsening dry eye. This is that vicious cycle that we need to stop sooner rather than later. And that's why it's so important to get things checked out on a regular basis, not just to monitor for diabetic retinopathy, but also to diagnose and treat dry eye in its early stages. Aside from its effect on all three of our tear layers, diabetes also affects the cornea directly. The cornea is considered the most sensitive part of the body with the highest density of nerve cells. And this is what can make dry eye so painful and debilitating. And just like diabetes damages nerves throughout the body, it also damages corneal nerves. Corneal nerves aren't just there to sense when the eye is scratched or damaged in some way, they also play a vital role in this feedback loop that helps to produce our tears. The corneal nerves can sense when the eye is drying out, signaling the brain to blink and produce more tears. This is why most of the time we blink without thinking about it. But when these corneal nerves are damaged, that signal is interrupted, which reduces the blink rate and the tear reflex, leading to tear film instability and increased evaporation. On top of that, diabetes slows the healing of corneal epithelial cells, making the cornea more susceptible to damage and irritation, and sometimes leading to ulcers or open wounds that do not heal easily. So what can be done? Well, it all depends on where you're at. If you're considered pre-diabetic, do everything that you can to improve diet, increase exercise, and make lifestyle adjustments to make these changes long-lasting to prevent the progression to diabetes. If you have diabetes, it's so important to control the blood sugar tightly and follow the medication protocol per your doctor's instructions. This, in addition to those lifestyle changes like diet and exercise combined, will help to slow the progression of the disease and prevent these severe stages of disease. It is absolutely vital to control diabetes at all stages, but I want to emphasize the importance of beginning the control at the early stages of diabetes to help to prevent things from getting to a dangerous level. These changes that we see in the nerves and the blood vessels in diabetes are essentially irreversible. And what I mean by that is, yes, sometimes the damage can be reversed, but it's usually if the damage is mild and recent. The longer the damage has been present and the more severe, the less improvement that you're going to see, and it's always going to be limited. It will never improve to 100% of what it used to be, and it's not that commonly seen. If you can prevent damage to the nerves and blood vessels at the early stages of the disease process and reduce oxidative stress and inflammation by properly controlling blood sugar consistently, this will greatly reduce the chance of developing dry eye, and especially severe dry eye that would cause these permanent changes in the eyes. If you do have dry eye, whether diabetes is the main contributing factor or not, it's really important to monitor and treat dry eye consistently and early on. As we've talked about, dry eye is often this vicious cycle where one thing leads to another thing worsening, which leads to more dryness and further worsening, and it's always going to be better to stop that cycle early on. Consider what we just talked about, Meibomian glands, how chronic inflammation can lead to the keratinization, which can lead to blockage, which can lead to gland atrophy. Wouldn't it be better to stop it before the keratinization rather than after the glands have already atrophied, when treatment's going to be more complex and require more time, energy, more treatments, and more trial and error to get the treatment plan right? It's always better to identify issues sooner to prevent them from getting to a severe level. If you want to learn more about dry eye treatments, I talk about every dry eye treatment I can think of in this video here, or you can check out one of my other videos here. Thank you so much for watching. I really appreciate you and hope to see you in the next one.